Welcome,
Hello.
everybody. I'm pleased to introduce you to Mr. and Mrs. Valdez. Mr. Valdez had COVID-19 infection and had an extraordinary journey. Unlike Maria, our last patient that we spoke with, Mr. Valdez's lungs didn't get better, and he ended up having a lung transplant. But let me turn it over to Mr. and Mrs. Valdez to tell their story.
Hello, y'all. My name is Reynaldo Valdez. I was currently working and still currently working, waiting to get back to work for Citibank. I'm a fraud investigator for Citibank. So my movements, my process, and everything I did counted on a $2 million monthly process that we save our company. That's our budget had increased to. Um,
Your turn.
and then that's where I was at before all this happened. Since this happened, I haven't been able to work. It's been since January. I have not been able to work. It's taken everything away from my lifestyle, my family, and myself. We know COVID does this to everyone, and right now it's taken a toll on a family. As you well know, it has taken a toll on everyone. Uh, but but the hardship for us was being moved away from the family, having to get new lungs, having to wait for the lungs, and during the process, um, having a stroke, going in cardiac arrest, and then being told that this might not happen because of the stroke. Um, Putting my family through a lot of grief and suffering, and not knowing what's going to happen tomorrow or tonight. Um, and that alone in itself is scary for me, because half the time I did not know what was going on. I had to wait till somebody explained it to me 4, 5, 10 times um, before I realized what was happening, especially after the stroke. I lost a lot of my memory. Thank God it's coming back. I want to say I'm about a 99% back with my memory, but as far as being able to work, I have the shakes real bad. I have to learn how to walk all over again. Um, it's been very stressful for not only myself, for my kids. I had two brand new granddaughters that were born while I was in the hospital. Finally got to meet them, which I'm very grateful. That was one of my biggest joys and things that I wanted to do in my life, is make sure I got at least to see, 60-year-old man didn't have any grandkids, and this is what I was waiting for all my life, to at least be able to see them. Then never expected this to happen. Expected to live a lot longer, and I still plan to, with the help of my wife and the support of my friends and family. Uh, they gave me the strength and the will to want to live and continue living. I could still remember the time that I went into cardiac arrest, and the doctors and the nurses kept asking me if I still wanted to continue, if they wanted to bring me back. I could hear shouts and scream, and all I kept saying is yes, because I did not want to give up like this. Um, I wanted more for myself and my family, and I wanted to be there for them. My wife could probably tell you a lot more of the things that happened in between, the stages that I went through. So I'm going to let her jump in and say her side of the story as to what she saw, and as to what happened.
Hi, I'm the wife. I'm Courtney. The journey started, I guess, January 26th. That's when both my husband and I got diagnosed with COVID 19. Um, he went ahead and contacted his doctor, his primary care physician, who prescribed him a nebulizer, steroids, antibiotics, everything you can think of at that point. Because it's so novel, I guess we didn't know the correct treatment plan. However, he uh, proceeded to decompensate. So the 31st of January, we took him to the Methodist, the main Methodist in San Antonio, and he was admitted. His oxygen saturation was pretty low. And 2 days later, I was admitted into the hospital. So both of us were in the hospital. I got out in 6 days and went through physical therapy for lungs and tried to recover. I went back to work on March 29th. However, my husband had a different journey. He uh, was pretty much on oxygen from the time he was in the hospital. Um, it had to be increased pretty much on a daily basis, to the point where they had put him on BiPAP. And on the 19th of February, I got a phone call, and from one of the nurses, it was in the morning, and they stated that he just went downhill really, really fast, and they had to intubate him, put him on a ventilator. And in the process of putting him on a ventilator, he went into heart failure, cardiac arrest. So they decided to put on, that's when ECMO was decided at that point, because it was involving the heart. They put him on VV and VA. There were 3 cannulas inserted, one in the right, one in the leg, one in the right leg, the left leg, and then he had his carotid in his neck. That stayed on for, I want to say the VA stayed on for maybe like a week or so, and then they removed it. So then he was on, he's cannulated through his leg and through his carotid. And so they were still working with him at the Methodist, and trying their hardest to, to get him off the ECMO machine, going down on the sweeps, trying, lower oxygen rates, everything they could possibly do. However, he wasn't able to tolerate that. In the process in San Antonio, he went through 2 bouts of sepsis. With the first bout of sepsis, they had to remove, they figured it was probably an unsanitary area to have the VV in his left groin. So they removed it, and they inserted both of the cannulas subclavian, his left subclavian area. And during that journey as well, he suffered bilateral pneumothoraxes. So he had 3 chest tubes inserted. But they kept him stable. They were able to keep him stable. He was able to do, a little bit of physical therapy, not as intensive as it was in Houston, but, they would get him out of bed. It was a tough journey, needless to say. It affected the entire family. I went back to work. So I was, teaching during the day and then running to the hospital at night, and just watching his stats, communicating with the nurses, with the doctors, trying to figure out what's going on, why they're giving him specific medications, trying to keep an eye on him, because he's very sensitive to certain medications, and he would get loopy. And so it was a very tough distinction between sepsis and maybe over medicating with, some type of antipsychotic medications. So we did that for a while, and they were never able to take him off ECMO. I think the lowest sweep they went down was like at a 2 in San Antonio. So the talk progressed to transplantation, and they had discussed it with my husband more so than me. I was very kind of unaware of the transplantation process. I got called from the social worker at the Methodist saying that they were getting the paperwork ready to send him to get the testing ready and the paperwork to try to get him a pre-evaluation at Houston Methodist, which was a total surprise for me. And so that was a tough decision in itself, because we have no family here. We don't have any support here in Houston. So it was going to be just a rougher journey. But I was told that Houston Methodist was the best hospital. They had the best doctors, that he would get the pristine care here. So we went ahead and did that. We were transferred from Houston Methodist, from San Antonio to Houston Methodist on the 28th of April. And he was put on UNOS on May the 8th, if I'm not mistaken. He was listed. They tried to keep him stable. They were working, physical therapy was going on. He was doing, pretty well, walking around the unit. And myself, I was running back and forth from San Antonio because I was trying to finish the year teaching. So I'd go back to work on Monday. I'd drive back to Houston on Friday, stay there during the weekend. Well, on the weekend of I want to say the 16th of May, I was there on a Sunday, and I noticed that his faculties weren't all quite there. It was kind of loopy. He was just hallucinating specific things. And so I talked to the nurse, and she said that they had put him on some antipsychotic medications because he was anxious, and they were trying to calm him down. And I asked her, I said, is there any way you could possibly maybe, dial down on the dosages, or because, I was just worried about his mental status. And what I really noticed is when I left on Sunday, it was raining and I had forgotten my phone as soon as I left the hospital. So I drove back to the hospital and I walked back into to his ICU room. And I told him, I said, honey, I'm sorry I had to come back. I know goodbyes are hard for you. I said, but I forgot my phone. I'll see you next Friday. And as I was leaving, he didn't say anything. It was just a very puzzling look that he gave me. And that was not him. So my suspicion is that maybe the stroke had started maybe the evening of Sunday. I'm not sure. Anyway, I went back to work on Monday and I got a phone call from one of the pulmonologists when I was at work stating that he had suffered a frontal lobe stroke and a right occipital stroke. And I left work, and from that point on, I went on a leave of absence and I stayed in Houston. His family went up there that Monday and we were talking to him. His dysphagia was pretty bad. He couldn't process his words. He just kind of looked at us like he was puzzled. And one of the ICU doctors pulled me out in the hallway and told me, Miss Valdez, you know that because he suffered the stroke, we had to take him off the transplantation list. And I just looked at her and I said, okay. And she says, and because he had the stroke due to the heparin, he can't tolerate it. He's probably not going to be able to go through the surgery because they use high amounts of heparin during the surgery. And I think I just still looked at her and I had this puzzled look on my face. And she said, so you're probably going to have a conversation with the family and see about putting him in hospice or making him comfortable, for the remainder of the time. And I still had that puzzled look on my face. And I said, what? And I said, you're kidding. And she says, well, because, we can't operate the ECMO machine without the heparin. And I said, he's been fighting for 4.5, almost 5 months. He's gone through bilateral pneumothoraxes. He's gone through sepsis. He was put on dialysis at one point. He's fought back every single time. And I can't tell him that it's over. And so I told her, I said, hold on, let me go into the room. So I walked into the room and I said, I said, do you know what happened to you yesterday? And he said, no, that, he didn't know. Well, he shook his head no. And I said, you had a frontal stroke and you had a right occipital stroke. I said, the reason you can't talk to me right now is you're having a hard time processing. You've got dysphagia. It's what you're thinking is not coming out through your mouth right now. So you're having a difficult time. But if you don't understand what I'm telling you, tell me, shake your head yes or no. And I said, they took you off the transplantation list. Do you understand that? And he said, yes. And I said, now let me ask you a question. Do you want to be comfortable and let time see what happens, or do you want to fight this? And he didn't hesitate. He said, fight. So I said, okay. We were in his room. And then about 20 minutes later, one of the pulmonologists came in, Dr. Yusuf came in, and he wanted to speak to me. And I spoke to him and basically gave me the same conversation that the ICU doctor had told me, that, he couldn't tolerate the heparin, that he wasn't going to be able to stay on ECMO, that we needed to have that conversation. And I still had that blank look on my face. And I told him, I said, Dr. Yusuf, I said, this is the best hospital. You're the best doctors. That's what I was told. I said, and I understand coronavirus is a very, very, it's a novel situation. You don't know what the outcome or the prognosis is going to be, but think outside the box. And, if the good Lord takes him in the interim, then we know that it was meant to be that way. I said, but I can't give up on him right now. So he left. And then I came back about, 20 minutes later, and he wanted to speak to me. He said, okay, we're going to go ahead and trach him, and we're going to try to get him off the ECMO. And I said, okay, well, that's a start. We'll go with that. But that wasn't the end of the journey, because he still wasn't put back on the transplant list. So me thinking all kinds of things, doing my research, doing everything I could possibly think, the brain crossing the midline, you build synapses, you work around detours, your brain is always able to heal itself in a certain sense. The damaged areas might not ever come back, but you can build, you can build detours within your brain. So I was thinking, well, let's go ahead and we're going to do mass practice with academics. And so the next day I went to the Dollar Tree and I bought whiteboards and expo markers, and I bought cognitive games, and started with very basic things with him. What's your name? What date is it? Where are you at? Who are your family members? Do you know what you used to do? And I drilled him and drilled him and drilled him. And he didn't give up. My normal husband would have said, "Are you kidding me? Stop doing what you're doing." But being, I guess, in the condition he was at, he was like, "Let's do some more." So I started with ABB patterns, like in kindergarten, spatial patterns. I downloaded cognitive games on his phone. We played those. We did crosswords. We did word searches. And I just kept him going and going and going and going. And I noticed on a daily basis, his memory started coming back. He was able to think of certain things. I would ask him, read him stories, and it's going to sound really crazy, but I would go into comprehension questions. Where did it happen? Who are the characters? What do you think is going to happen? Everything you would do in a school with young children. And, we got a phone call they were doing the physical therapy as well. He never lost use of his right side of his body, which was a good thing. So he was always able to do the physical therapy and, pick up his arms, move his legs. He was very active. So it was just the mental state that we were worried about. But with the practice and doing the things that, with mathematics, we were counting, we were doing, linear equations, we were doing just a lot of things. And I think we were able to, detour and build those synapses, and, his cognitive abilities came back. So then I guess on on June the 8th, we got a phone call. My son had graduation, and we got a phone call, and Dr. Huang had told us that they had went ahead and agreed to put him back on the transplant list. And then we got our wonderful phone call on the 16th of June stating that they found some lungs for him, and he was transplanted on the 17th of June by Dr. MacGillivray. So that's pretty much our journey.
Well, thank you so much to Mr. and Mrs. Valdez for sharing. I'm Errol Bush. I'm also one of the co-moderators today. It's very nice to meet you.